Greetings and welcome to another edition of Caring About Seniors. I am your host, Adrienne Houghton. Now, as you know, each week I sit down with Oasis Senior Advisors Jacksonville and we discuss all aspects of senior living. Today I'm being joined by Al Bagocious from Oasis, and our guest is Joanne Hickox from Seniors on a Mission. Welcome.
Thank you.
Good morning.
Good morning.
Now, Joanne, before we talk about one or two of the programs that Seniors on a Mission have, it's been going for over 20 years and it started really with seniors and monthly social outings. Tell me how it's developed on from there.
Well, we discovered very early on that seniors wanted purpose. And so we created a day-long service opportunity where a bunch of people, typically 20 to 35 people, would get together, and between 10 and 2, they would knock out a really large project for a local nonprofit.
And it was as simple as that.
Well, you had to have lunch.
Of course.
You had to have free lunch. But we have worked with over 130 different nonprofits here in Jacksonville, Florida. And the seniors to date have given back more than $3 million worth of service.
Now, you've watched over the years how seniors are interacting with technology.
You mean the lack thereof?
Or the lack thereof, yes. And so recently you have started technology pop-ups. Tell me what they are.
Well, before I tell you what they are, let me tell you how they came about.
There we go.
We started, well, at the very beginning of the pandemic, we were delivering food with our bus. And our rent went from $500 a month for our office to $5,500 a month. Wow. Yeah. Shock. We were just, we couldn't believe it. So we went away for the weekend and we fasted food, electronics, and conversation. And we just wrote down what we heard. And when we came back together as a team, we all agreed that we had heard the Lord say we were going to go mobile. And we were laughing at each other because we didn't know what going mobile meant. It was like, okay, we're going mobile. And we went back, we talked to our board of directors, we've talked to our some of our lead donors and said, we believe this is where we're being led. And within 5 months, we had chosen, renovated, and had paid in full a 40-foot mobile unit that we now take out and use for technology pop-ups. So that's how it came about.
Wow.
Now, a technology pop-up is where the mobile unit will drive to, typically it's a church parking lot because we do it Monday through Friday. So church parking lots are more accessible during the week.
During the week.
Basically. And then we will go directly to HUD Housing senior locations. And we will park in their very tight parking spots. But we open up the mobile unit, and there is space for 4 trainers to teach one-on-one senior adults. And we schedule 5 sessions per day, times that number of trainers. So that is a pop-up.
So between 10 and 2?
Well, typically the appointments, yeah. We start at 10. We have a 10, an 11, a 12:30, 1:30, and 2:30. Typically 4 people will get trained. Occasionally, we have 5. They all love to come up inside the mobile unit. The mobile unit is gorgeous, absolutely gorgeous. But it also feels like when they were younger and they were traveling in the country, or they had friends that had a mobile home, a mobile unit. Although the king-size bed in the back has been totally renovated into an office, which was really gracious of a pastor friend of ours, designed that and executed that for us. The other cool thing is the whole side pops out. Oh. And in the front, the kitchen pops the other direction. It's huge. It's 10 by 10 inside. And so when there's 8 people inside, you don't feel crammed. You don't feel anything. It's like you're in somebody's living office.
Wow.
And the other wonderful thing is the whole side of it that pops out has an awning that goes out 10 feet. So we register everybody outside, and then we have had occasion where we've had paraplegics come up. And so we train them outside. And, or one time I had a lady who had an emotion dog. And, well, she was fine to go inside the mobile unit, but the dog was freaking out. The dog was barking because it didn't have eyes on, and I thought, wow, the person is actually the emotional support here for the dog.
Now, these technology pop-ups, you know, people can come along and they can bring their phone or a tablet. And they can focus on whatever they want to focus on with their trainer within the hour.
Yes. Well, it's a 45-minute session.
Okay.
Because we need a break between that person and the next person. It's a 45-minute session. And do you have a phone, Al, on you?
It's sitting over there.
Oh, okay. Well, what I was going to say was they bring in their own mobile phone or their own tablet. And we work directly across from them. And we grab their phone and we point it towards them and we work upside down. And we say, okay, now hit this button. Now touch this. Now scroll this. No, you got to scroll that a little faster.
Yes.
And we work with them. Now, they all come with their own list of things they want to learn. But we've learned that there's 4 or 5 things that they need to know before we jump on their list.
Basics.
Very basic.
Technology 101.
Kind of like, is the lettering big enough? Can you read it? Because if the font isn't large enough, then we can go in and make it larger for them. The other thing is when people get a phone, it's generally, when it comes directly from the factory, it's set for the lowest amount of go black time, which, you know, they're trying to make sure that your battery doesn't get worn out really fast. Well, for a senior, they stepped away to get something, they came back, and their phone's black. Because they went to do something, and now their phone is, and they have to go through. Some of them, they literally are thinking about what the next decision is, and it goes black because it's set to like 3 seconds or 5 seconds, and it's like, who does anything in 5 seconds?
Well, teenagers.
Well, yeah.
I mean, I can remember a couple of years ago now, but a friend of mine said, "Where's a teenager when you need one?" and was having trouble with her phone. But in fact, you know, I know that there's a lot of seniors, you know, whose children actually grab it and say, "Oh, here we go, it's done." And they say,
and that's the problem.
Oh, I wanted to know how to do it. Yes, next time. And nobody's got time. But this is an opportunity for them to actually feel as though...
We always let the senior do the work.
Yes.
Like, you have to learn how to do this, because if you don't learn, we haven't really been successful in helping you learn what you need to know.
Yeah. But if you don't actually do it yourself, you don't remember it either.
True.
So it's one of those things.
Yeah.
So you do other things as well. Seniors on a Mission, and I have to say that you are the executive director, but you were the founder.
Yes.
Of this.
Yes.
So this has been really a mission for you from the start.
Well, I'm the oldest of 42 grandchildren. When I was born, all I had was senior adults around me. Well, they weren't senior adults at the time, but to me, they were all 20 to 30 years older than I was.
Right.
And so I grew up loving people 2 to 3 decades old. Also, and Al knows this, I'm married to a man who's 25 years older than myself. Nice. Brian is 83, going to be 84 next month, or in July. And I mean, we've been married 35 years. And I just love senior adults. I find them so interesting and curious, and
we're just a lovable bunch.
Yeah, joy to be around.
Yes.
And that's the other thing about what goes on with the technology pop-up is we are taking the time with them to make sure that they know what they need to know and that they do it joyfully.
Yes.
So.
I mean, you've obviously come across a lot of seniors that need help, and have you put them in touch with Joanne?
I haven't put them in touch directly. I'm a knockoff of hers, because what I love to do is to teach my seniors how to text. That is so important. And we had one guest here, Hank, who we religiously text with each other, and it's so important because My newest senior has what Bruce Willis has, aphasia. So she lost the entire capability of hearing. So with her needs and her wants and what we have to do for her, we're texting 24/7. And that's such a good thing to have for our seniors. And I'm sure you see seniors texting like crazy after a while once they learn how to do it.
Once they learn, yeah.
Once they learn, yes. It's connection for their grandchildren, for a number of things.
The other thing is, we had a gentleman who came in with a flip phone. And we had to learn how to do the flip phone because, we do Androids, we do Apple, we do all versions of them. And if we don't know it, we Google it and figure it out. But we had a gentleman who loved his phone. But he was beginning to forget phone numbers. And his daughter said to him, unless you recognize the phone number, do not answer it, as a safety issue, because she didn't want him getting scammed. And I totally understood. But he came to our technology situation and said, I don't know when my grandchildren are calling me because they change their phone numbers so often that I don't know their phone number. And I can't pull out my list and look and see. So we taught him, in the old phones, you had to hit the A 3 times to get to C. So we taught him how to, and we sat with him for, the 45 minutes, and we entered every family member, called it to make sure we got the right family member. And now he is empowered because he knows when the name pops up, he can recognize the name. But it's a dignity thing.
Yes.
And
Yes,
he didn't
of
want to
course.
tell his kids that he couldn't remember phone numbers as fast as he used to. And so it was such a joy for us to watch him go home just, proud of himself and excited. And
Joanne, there's so much more I want to ask you, and I know that there's so much more that you do within the community with seniors. But we're going to have to cut it short. I know, but you have to promise me that you will come back soon.
okay.
Because I really want to know more about the mission trips that you're still doing and everything else in the community. But thank you for coming in, and thank you for what you're doing, because somebody needs to have a little bit more patience, and luckily you've got it.
Well, and I just want to make sure everybody knows www.seniorsonAmission.org, technology pop-ups. They can see where we're going to be and who to call to sign up.
Perfect. Thank you so much.
Yay.
And don't forget, if there's any more information that you would like to know about Seniors on a Mission, it's seniorsonAmission.org.
Yeah.
Thank you for joining Caring About Seniors. I look forward to seeing you next week.
We are local. We are your local experts in senior housing. We have taken the time to personally set foot in just about every licensed senior community in Northeast Florida. I think that sets us apart in that intimate personal knowledge of the communities in Northeast Florida. We are local. We are your local experts in senior housing. We have taken the time to personally set foot in just about every licensed senior community in Northeast Florida. And not just, be there, but also pay attention to, is the same staff there, or are they having turnover? Are the residents smiling? Are they happy? Are they interacting with the staff? And what is the culture? What is the personality? There's a lot of intangibles that we pick up on and remember when it's time to match a client with the right community. The intangibles are as important as the tangibles. And I think that sets us apart in that intimate personal knowledge of the communities in Northeast Florida.
Greetings and welcome to the latest edition of Caring About Seniors. I am your host, Adrienne Houghton. Each week, I sit down with Oasis Senior Advisors Jacksonville and we discuss all aspects of senior living. Today, I'm joined by the president of Oasis Senior Advisors Jacksonville, Mr. David Stieglitz. And our guest today is Mr. Bill Green from the Green Insurance Agency. Good morning, gentlemen.
Good morning.
How are you?
Well, thank you.
It's been a year since you've been in.
It has.
And a lot of things have changed, but tell us a little bit about how long you've been in the industry and what brought you into the industry.
Okay. About a month shy of 8 years, and a good friend of mine showed me how we can help people with it. Kind of made sense to me because both my parents went on Medicare many years ago. My mom about 9. No one really sat down and explained this is what it is how it works. About a year and she was diagnosed with breast cancer, so right when I started in the industry. She caught it really early though, so she's fine. But no one explained all of her options to her to give her a cheap cancer plan to go with it or a little more coverage. So she had some pretty hefty out-of-pocket bills that no one really explained well to her how to cover those. And I want to be able to help people understand what's available, what's out there, and protect themselves from that kind of stuff.
So what are your primary lines of insurance?
Well, I primarily focus on Medicare as well as health insurance. Then there's lots of things that go with that. So there are accident plans, hospital plans, dental, disability. We also write life insurance. It's not something we're actively looking for, but it's something that's needed as part of the plan.
Long-term care.
Definitely long-term care. People usually don't want to talk about long-term care. It is absolutely needed though. The old traditional long-term care insurance policies are kind of going away. There's some really good older ones and some that weren't designed that well. They're really moving more towards either an asset-based long-term care, or kind of the new one is actually a function of life insurance, where either your family's going to get some money when you pass, or you're going to get all the long-term care benefit. So it's something that's fairly new, and it's no longer of, hey, I paid all this money, I didn't use my long-term care. It's, I'm either going to get the care I need, or my family's going to have a legacy when I pass.
So is this like life insurance with a rider for long-term care?
Exactly.
Ah, so if you don't go into long-term care, then you've got this nice life insurance policy.
They're not small policies. We don't have to do them that way.
Yeah.
So yeah.
Exactly. Now you're here to discuss a book that you wrote.
Yes.
Would you like to tell us about it then?
Absolutely. A colleague of mine and we worked on the book together, and I get asked the same questions over and over when it comes to Medicare. So we thought, you know what, let's put some pen to paper and get those questions down on paper so I can give it to someone before I meet with them. They can request it either through a website, or I've got a text and number that they can get a copy of the book before we even meet, so they'll be more educated and know what questions they need to ask.
I mean, Medicare is incredibly complicated. So how long is this book? Is it sort of, it looks thin and small, but in fact...
It's fairly thin. It's 74 pages.
Okay.
Large print though, so easy to read.
Well, that's one thing, isn't it? Because obviously people getting older are the ones that are going to need this, and they want to be able to read it.
So with Medicare changing so much each year, are you going to have to update it every year, or
Not
have you
really.
kind of got the core of it that it's pretty stable?
This is the core. It's got, the first half of the book is Medicare and its parts, which are not going to change a whole lot year for year. Be little things like your dollar amounts for hospital stay, your deductible, and whatnot. Those will change. And the second half are how to avoid 7 costly mistakes when it comes to Medicare. And those are things that those aren't going to change either. It's about penalties and not enrolling at the right time or enrolling in the wrong plans and what can happen.
I mean, we're talking about Medicare, but are there any other topics in there?
Yes. So no matter what plan you pick with Medicare, there's going to be some level of hole to it, whether it's some higher copays, more exposure for cancer, whatnot, or if you pick a more all-inclusive plan, Medicare unfortunately doesn't care about your eyes, your ears, your teeth. They'll cover you if it's a medical thing, like if you have glaucoma or cataracts, they'll take care of that. If you have an infection in your mouth or you need reconstructive surgery after an accident or something, they'll take care of that. And ears, if you have an imbalance, because that's where your balance is, if you're falling because of that, they'll help you. But they're not going to give you glasses. They won't help with crowns, fillings, dentures, and they won't give you hearing aids. So that is something that is not part of Medicare, but there's ways we can cover those either as part of an all-inclusive plan or on top of.
I mean, it's pretty mean, really, isn't it? Because you do need to see, you do need to hear.
Absolutely, it doesn't make sense.
You need your teeth. I mean,
You do. So, I mean, Medicare's idea is they'll take care of your health and your body so you can stay alive. But you're right, if you can't see where you're going, you're likely to get hurt. If you can't eat, you'll become malnourished. So they should cover it at some level. There are talks of making it happen. But if that happens or how it happens is yet to be seen.
golly gee. I mean, and half of that is really preventative too.
Oh, it is.
So, I mean, it would be better if they said, you know, let's try and prevent it so that when we actually get to the end result, there's less people that we're having to pay out for. Doesn't that make sense?
It's a government program, Adrian. It doesn't make a lot of sense.
So it really
Well, there you go.
it does make sense. They should do it at some level because mouth disease is actually linked to many of the diseases that happen in the body.
Yes.
Right. So who is this book actually designed for then? Is it designed for people who are younger so that they know what's going to be happening in the future, or?
It's designed for a few different people. One are those who are just going on Medicare for the first time, who need help figuring out how Medicare works and what it's going to cover. For people who have been on for a while and need to understand just how it works. Maybe they didn't get the best explanation when they started. They either signed up online or somebody came in and 5 or 10 minutes later they had a plan and that was it. And then also I'm having more and more people come in with their adult children to help them understand what's going on and help them make the right decision going forward.
So actually, the adult children are the ones that are really going to benefit from this, not only for their parents, but also for themselves for the future. Just getting a little taste of it.
Yeah.
I mean, I've learned so much from Dave and from Al over the last year about what happens when you get older and what you need to be doing. And I don't know that we can say enough about it. We've got to really keep drumming it home. Yes. Start early. Start looking at these things in your 50s. Don't leave it to the last minute. Would you say that is the same about insurance?
Definitely. So we don't just do Medicare, and we do regular health insurance as well. So if someone is currently uninsured and can't see a doctor and they have something going on, depending on the situation, we may be able to help them enroll throughout the year, or we just have them ready to go for open enrollment at the end of the year so that they can have those things looked at and not just put them off until Medicare.
And you'll help them with that?
Oh, absolutely.
Yeah, that's wonderful.
Yeah.
So if somebody's looking at this and they say, oh, actually that book sounds like it might be very useful, how do they find the book?
They can go to MedicareAlphabetSoup.com. Just nice and easy.
Yeah.
They can request either a physical book or a digital copy there.
And is it expensive?
No cost.
Oh, you see? A free book. How often do you get that? I mean, Medicare doesn't give you everything, but Bill is providing people who want all this information for free. That is wonderful.
Yeah.
Is there anything else that you would like to tell the people out there about what's been happening or changes in insurances recently?
Yes. So more on the regular health insurance side of things, the marketplace. That has reopened for anyone who qualifies with 150% or less of the federal poverty limit. For a family of 4, that can be $50,000, $60,000. They can enroll year-round in health insurance. If someone is, whether they're under 65 or over 65 on Medicare, and they need to enroll after losing group coverage, it's something you have a very small time window to do to be able to get it without any health questions.
Wow.
So insurance is all about timing.
Yeah, yeah, absolutely. And does everyone know this?
Not at all. I get the same questions over and over again. That's why we wrote this book about Medicare. And then the health insurance, it's one I plan to work on as well, because I actually get more calls about regular health insurance because, well, there's more people who need it.
You call it alphabet soup. I mean, because it's covering I guess a lot of information. What do you think is the most valuable piece of information in that book that people will take away?
Well, first before that, the alphabet soup. The reason it's the alphabet soup Medicare is because when it comes to Medicare, you have your initial A and B, and then you have to decide whether you want to use an A, B, C, D, F, G, or N with it, plus a D, or you can do Part C. So it is really just a bunch of letters. You have to pick the ones that are right for you. Yeah.
Hence the alphabet soup.
Exactly.
Okay.
So there's no one just golden nugget in there. This is the basics. It'll save you hours of trying to read the Medicare New Book. That when I'm ready for a nap, that's what I read because it's that interesting, even for me. So it'll save you hours of trying to read that book, of watching YouTube videos. This is just the nuts and bolts. It's maybe an hour read max.
What are the most common mistakes people make as they're approaching 65 or turning 65 regarding Medicare?
I talk to a lot of people who get fed up with all the phone calls and mail, people knocking on their doors, Facebook ads, and they, one, will either just go and pick something themselves, or they do nothing. The do nothing folks are a lot of times people who are healthy, and the problem with doing nothing is you will end up with lifetime penalties. You don't enroll when you're first eligible. Part B, you'll have a 10% penalty on your prescription side of things. You can have a 12% per year penalty for every year you went without having a plan.
Oh, wow.
Yeah.
And so that's how it goes.
Definitely at 65, you've got to do something.
Yeah.
Yes. And then there's a whole other crowd of folks who are on Medicare that aren't really marketed to, so they don't have all the same information that's just being thrown at them. And those are people who are on Social Security disability. So if the Social Security Administration says you're disabled, you can no longer work, you can't work in your profession or something similar, and you're put on Social Security disability, 24 months from your start date, you're automatically enrolled in Medicare. And it's something that, again, they're not getting bombarded with all this stuff to pick from. They have to go out and do their own research.
Right. And that's where you come in.
Yes.
Well, thank you, Bill. It's been an absolute pleasure to find out more. And thank you for doing this. I know it's helping a lot of people. It's good to see you again, Dave.
Good to see you.
Now, I'm going to read this because I don't want to get it wrong. So if you want a copy of the book, you can get it from medicarealphabetsoup.com or text the word book to 904 747 6711. This has been Caring About Seniors. I'm your host, Adrienne Houghton. Thank you for watching.
We are local. We are your local experts in senior housing. We have taken the time to personally set foot in just about every licensed senior community in Northeast Florida. I think that sets us apart in that intimate personal knowledge of the communities in Northeast Florida.